Okay, so he's talking about 2 masks. That was a clip of Dr. Anthony Fauci supporting the use of double masking to be more effective in protecting you against the virus.
So should we all be doubling down on wearing double masks? Joining us now to weigh in is family physician who has closely monitored and reported on this pandemic, Dr. Jen Caudle. Dr. Jen, always great seeing you.
It's good to see you too. Good morning.
So I do remember when the pandemic first started, I did see some people wearing double masks. Maybe they couldn't get their hand on the N95, so they were wearing double cloth masks. So here we are now, almost a year removed from when the pandemic started, officially talking about wearing double masks. So where did this notion come from?
Right. So I think there was a lot of sort of interest that increased after the inauguration. We saw a lot of people at the inauguration doubling their masks. And I started seeing an uptick in reporting and sort of commenting on that. But it really is sort of a timely topic because right now, as we know, January 2021, unfortunately, has been the deadliest month for COVID. We're averaging 3,000 or so cases per day. We know that in addition to that, we have these new variants that have come out that are more highly transmissible. So, it makes sense that if there's any time to double down on our efforts to really stop this virus, it would be now.
So you're talking about supporting the double mask proposition out there, but I want to ask you about, there are some reports that are showing people should maybe wear 3 masks. I know we could continue with the numbers here, but they're saying 3 masks are about 90% effective, where double masks are about 75% effective. Where do you stand with this, and should we just keep rising with the numbers?
Sure, sure. Well, we certainly want as much protection as possible. What I would say to start at a baseline is there are many Americans who are not wearing masks at all. I don't want to forget this group of our fellow colleagues. I encourage everyone to wear a mask. That is the first thing that we need to do, along with our other measures. So, by the way, this does not replace social distancing, et cetera, and things like that. When you think about the idea of adding layers onto a mask, it seems to kind of make sense that it perhaps would make it more difficult for virus transmission. So, we can see how that may happen with 2 masks. Perhaps 3 masks as well, but there are some caveats with that, guys. Remember, we have to make sure that we're still comfortable enough to be able to function. We need to still be able to breathe, breathe properly. So, it's not that I'm saying that people have to wear 3 masks or even always wearing 2 masks. Right now, the CDC, their recommendations are still 2 or more layers for a mask. The World Health Organization, if you go to their site, they have a really, really great tutorial. They have great tutorials on how to make 3 layered masks themselves. But, I do think that in certain situations, and for peace of mind and for added protection, 2 masks could be a reasonable option, but we have to weigh those with, again, as we get higher in the masks, the
numbers.
Breathing.
Exactly. And it seems like a lot of the concern is coming as we watch these 3 variants of the coronavirus. Reportedly, it's supposed to be more contagious. There's still preliminary research being done to see if it's actually more deadly than the coronavirus. We had earlier video that showed people wearing the face, I guess the visors or the face coverings, the shields. Should we be wearing them as an accompaniment with our triple masks?
Well, so, once again, this is all about, we have to weigh everything here. We do know that wearing a shield along with a mask is going to give you more protection than not wearing a shield at all, because that's going to give you eye protection, right? So that's certainly a good option, no matter how many layers or how many masks you are wearing, right? Because that adds eye protection. Of course, we don't want people to just wear the shield without the mask, because the mask is number one. Once again, I would say that this is really the time to double down. So if you were only wearing, say, 1 mask, first of all, your mask should be at least 2 or more layers according to the CDC, or 3 layers according to World Health Organization. You may consider double masking, especially in those areas where you're going to grocery shop, or maybe you have to be out with others. If you have to take public transportation or things like that, that could be a good option. And of course, a face shield would add more protection to that as well.
Yeah, absolutely. Now, last time we spoke with you, you just got your first dose of the vaccine, and I remember it distinctly because you said, I'm very proud of that. Have you gotten your second dose, and how does that feel?
I did. I actually got my second dose about almost a week ago today. I got the Moderna vaccine. That's me getting my second dose. Still very, very prideful. I was very excited to get that. It was almost like a wave of relief that kind of washed over me as I finished. I'm doing very, very well. I had some mild to moderate symptoms after getting the vaccine, which we know can happen. And that's one thing I think it's important for people to know that can happen. But, once again, when we get those symptoms, if we get them, it's a sign that our immune system is working. So, again, I'm feeling great. I'm very, very happy and proud and feel honored to have been able to get the vaccine. And I highly recommend everyone get the vaccine who qualifies. That is one of the big things that's going to get us out of this pandemic.
Absolutely, doctor. Right from your mouth, from someone who has experienced it. Thank you for joining us as always. We really appreciate seeing you.
Thank you. Good to see you.